All right, good afternoon. I'm Sasha Forson. I'm the Assistant Director of Nebraska, and I would like to welcome you all today to our webinar, Nebraska Policy and Advocacy. Our event today is recorded, just FYI, and is hosted by Nebraska Women in STEM, an initiative led by Nebraska Cures and Nebraska. At Nebraska Women in STEM, we are driven by a mission to reduce barriers for women in STEM and to create an environment in Nebraska where they can thrive in their chosen careers. As part of this mission, we recognize that many women in STEM are interested in learning more about advocacy. We hear it a lot. We hosted an advocacy event last year and had lots of requests for a follow-up to that. So one dimension of advocacy is engaging in the lawmaking process. And so we developed this webinar today to give you a look at the kinds of issues pending in Nebraska this year. Before I pass it along to my colleague and presenter of today's webinar, I would like to take a moment to acknowledge our upcoming conference. Our Nebraska Women in STEM conference for 2024 is sold out. Thank you so much to all of the sponsors and registrants who are here today. We are sincerely grateful for the overwhelming support of this event. We doubled our conference from last year. If you missed out on registering, no worries. You can always reach out to us. We can put you on a waiting list. We do have a growing waiting list going. We can't promise that we can get you conference access, but please reach out. Things can shift at any time. And we also do have many more events planned throughout the year, webinars like this one, and also some in-person events. So stay tuned to learn more about the upcoming events that we have in the works. Now I will pass things on to my Nebraska Women in STEM colleague and Executive Director of Nebraska Cures, Amanda McGill-Johnson.
Thank you, Sasha. Welcome, everyone. We've put together a presentation for you today to give you a sense of the different types of legislation you might be interested in when engaging with lawmakers, either now or in the future. So we're really trying to target a broad brush, give you a sense of what maybe our organizations are looking at, as well as some other bills that may be of interest to you. As many of you may know, I am a former state senator here in Nebraska, so I love every opportunity I get to be able to talk to people about the legislative process and how to make the most of it and engage in it. So if you have any questions during this presentation, please go ahead to throw them into the chat, or I will stop and ask for questions periodically, and feel free to go ahead and unmute yourself and turn your video off and ask that question if you feel comfortable doing that. Otherwise, I'm going to share my screen here. Hold on a moment while I pull up our slides. All right, hopefully everyone can see that. Sasha already gave you, get it going here, gave you a brief overview of Nebraska Women in STEM. This partnership is a partnership of Nebraska and Nebraska Cures, but you may not know that much about Nebraska or Nebraska Cures. I don't know. So I'm going to give you a quick summary of those organizations, because as we talk about the bills that our organizations are following, it's really important to look at the lens that we bring to those legislation and why we may be supporting or opposing a bill. So Nebraska is a nonprofit trade association dedicated to supporting and promoting Nebraska's bioscience sector and ensuring the sector grows and thrives. So those bioscience businesses, universities that want to be a part of that are members of Nebraska as a trade association. Nebraska Cures is a nonprofit 501c3 that supports, promotes, and advocates for scientific research and education to advance our quality of life and our economy. So we advocate for medical research as well as many public health initiatives. And then the other bills like we're going to bring forward are bills that we identified might be of interest to women, primarily around women's health and maternal health, just to give you a broader scope of legislation beyond our two organizations. So why is public policy important? It's important because it impacts how we do our work and live our lives, how we do our jobs. In many cases, if you're working within an industry that's heavily regulated by the government, you can impact system change. You can be a part of exciting new initiatives that might be coming through state government or local government. And of course, government funding flows through legislative bodies and taxes. We're not going to get too deep into taxes today, but obviously that impacts us. It impacts business and operation. And if you ever do want to learn more about that, I am a resource as well. We just won't dig too much into that today. I'm going to start with kind of a broad overview of the legislature for those of you who are viewing who maybe aren't as knowledgeable about the process before we dig into those bills. First, Nebraska is a one-house unicameral. We're the only one in the country. Every other state has a House and a Senate. We have 49 state senators. I'll show you a map of those in a few moments. The salary of state senators is just $12,000 a year plus travel expenses for senators who live outside of Lincoln. This is probably not as much as you might think it is, and it actually makes it difficult to recruit people to run for the legislature. Our legislature operates on a 2-year cycle, so it means if a bill is introduced in 1 year, it moves over to the next year. We are in year 2 of a biennial cycle. In those 90-day sessions, they're longer in the first year. The legislature develops a full budget for our state. And then in that second year, they come back and make tweaks before the cycle starts all over again the following year. Leadership in our state is elected by secret ballot because we are officially a nonpartisan legislature. People may be a Democrat or a Republican, but they're not counted that way when it comes to the structure. So we are the only state that manages our leadership like this. In other states, if you're the majority party, you select all of the leadership. And bills in our state are introduced in the first 10 days, and every single one gets the public hearing. That is also unique. You'll hear our state is very unique from others. So maybe you've moved here from another state. This is a very different place of operation for our legislature. And finally, about a third of bills get passed every year. That's over 200 typically. This is a statewide map of the legislative districts, so you can get the sense of how large some folks' districts are. So when you look at the different perspectives of state senators and where they may stand on bills, geography and can have an impact on that. Each district represents about 35,000 people, and you'll see how big LD 43 is compared to some of the small districts in the Omaha metro area here. There is a nice tool on nebraskalegislature.gov that allows you to put in your address to pull up your state senator if you don't know who that already is. And then the last little 101 piece of information is I'll talk a little bit about the pathway a bill takes to get completed or to get passed. This is a lot of jargon and complex, so I don't expect anyone to remember this if they're not familiar with it already. But it is important to go over it real quick because I'll be using this language later in the presentation. A bill starts by getting introduced. It then gets sent to a committee for its public hearing. If the committee approves of the bill, they can pass it on to the whole legislature for its first round of debate, which we call general file. It's not an intuitive word, really, but the general body gets to hear that piece of legislation and decide if they want to allow it to continue to advance or have amendments made to it. If it continues on the process, it goes to something called enrollment and review. That's E&R, where legislative professional staff look for typos and errors and how things are written in the bill. And then they bring it back to the full legislature for select file. That is the second round of debate. But before then, if it gets past that round of debate, that second round, it goes back to the legislative staff for engrossing, like finalization and technicality stuff. And then it goes to final reading where legislators make their final vote on a bill, of which it then can pass and get signed by the governor. This is a new chart actually that's available on the legislature's website on bills to show you where each bill is in the process. That's where I pulled this information from. So we'll start talking about the bills that are priority bills for my organization, Nebraska Cures. I do want to note as we go into these that you'll see support or oppose next to some bills. We are bringing these for you to learn about them. We don't expect everyone viewing to have the same opinion as Nebraska Cures or Bio Nebraska on our bills, but we want you to get educated. We want you to ask questions. And if you want more information, you can reach out to our organizations for more or the senators involved with them, and we can direct you in how to do that. So don't feel like we're saying you have to feel the same way as we do. We want to educate you first and foremost on just the scope of bills that are out there. So we have as Nebraska Cures, we have a number of bills that we've been following. We primarily submit letters of support or opposition in our case. So the first bill is LB 857. It creates a Nebraska Prenatal Plus program. This is Senator George Dungan's priority bill and is actually on select file already. It creates a program that models a program in Colorado that provides additional care to women on Medicaid who need prenatal support. So it provides more counseling support, more dietary support, extra wraparounds like that aren't just the specific prenatal care. So this bill is expected to pass over the next month or so. LB 913 requires a state plan amendment for postpartum coverage under the Children's Health Insurance Program. So Senator Hunt is attempting to fill a loophole, I guess, in a bill, some legislation that was passed last year that expanded postpartum coverage for women on Medicaid to 6 months after childbirth. But there are some moms and situations where their insurance is under CHIP, Children's Health Insurance Program, and those moms were left out of that. So this includes those moms in 6 months of postpartum care. This bill was just voted out of committee the other day. I don't know. My guess is it will end up being amended into something else to get across the finish line. LB 1023 from Senator Von Gillern provides for income tax deductions for certain research or experimental expenditures. This is a bill trying to address kind of a tax credit program that expired a year ago and trying to get that back in place to help with research and development. I think it's things like equipment for those who may be doing research in the private sector. LB 1060 is a bill from Senator Hansen that provides an exemption for families who don't want to have their newborn screened for a variety of diseases that right now babies are automatically screened for. And early screening does catch things that might be rare, but if you catch them early, you can do a lot to improve the outcomes for those babies. That bill is in committee right now. It has not advanced or been prioritized or anything like that. LB 1064 from Senator Lippincott eliminates tenure at public institutions. This one's gotten a lot of press. It has not gotten out of committee or been prioritized, so I don't think it's going anywhere this session. LB 1172 from Senator Von Gillern helps researchers get better access to cancer registry data. This is a bill that Nebraska Cures actually brought to Senator Von Gillern, and I'm going to talk more about this bill a little later. LB 1184 from Senator Bostar is a tax credit for reverse osmosis systems. So he's trying to get at the problem of there are wells that are contaminated from having too many nitrates in the water of those wells, and there are free ways that families can get testing kits to test their water. Are there too many nitrates in it? Is it healthy? But it's very expensive to fix the water. And so what he's proposing is a tax credit to help into families or to compensate for the expense of those systems. That bill is still in committee. LB 1330 from Merman, Senator Merman, prohibits public educational institutions from taking certain actions related to DEI. This is an organization about women in STEM, and we partner with a lot of our university friends and their work in those areas. So that was definitely something that Nebraska Cures was engaged in. And LB 1368, Senator Eibach, she has her Nitrogen Reduction Incentives Act. And this is a bill that she has prioritized. I'm not sure if it has been, it's on general file now, so it was advanced out of committee. And this is, trying to deal with that same problem from that Senator Bostar was trying to get at with the nitrates in the water, but trying to incentivize agriculture to do more, choose different products, make different choices in terms of fertilizers and other products that they might be using that contribute to nitrates in the water and elsewhere. So those are the Nebraska Cures priorities. For Nebraska, these are their bills of interest that they've been watching. Many of them, I'm just going to give the heads up, many of them are about pharmaceutical prescription drugs, things of that nature. That is not something I have a whole lot of background in at the moment on these bills, but I am going to run through them so you get a sense of that scope. And I know there are some on here who may work in that field or be related to it, who might be of interest and would maybe even know more than myself. But LB 833, its public hearing actually hasn't happened yet. These three bills, the hearings are actually next week. So if you wanted to chime in and share your opinion on them before they even have their committee hearing, you'd be able to do that. And a little later in this presentation, I'll talk about how you can chime into public hearings. So this first one establishes Nebraska Prescription Drug Affordability Review Board. So this board, among many duties, would have the ability to establish an upper payment limit for prescription drugs after performing an affordability review. LB 990 addresses the practices of pharmacy benefit managers that restrict patient choice and access to preferred pharmacy providers. And LB 984 seeks to prohibit 340B drug manufacturers and wholesalers from interfering or denying with the sale of those drugs to any pharmacy that's under contract with the entity to distribute 430B drugs. And for those who don't know what those are, federal 340B, the federal 340B drug pricing program allows qualifying hospitals and clinics to treat low-income and uninsured patients to buy outpatient prescription drugs at a discounted rate. That is one where I personally need to study more about that issue. Next, we have LB 1002. Its hearing is actually today, so you can watch it on the legislature's website if you're interested, and it increases the amount of tax credits available for retailers of higher blends of biodiesel. LB 10, well, we talked about LB 1023 already because that was also on Nebraska Cures list. But LB 1072, which is still in committee, defines sustainable aviation fuel and provides a tax credit for certified air carriers that then purchase that fuel. Then we have LB 1095, which this hearing is also today. And this is what insiders, I guess, refer to as a cleanup bill. So last year, a bill was introduced and passed on E15 access at the pump that established criteria for how gas stations can sell E15 and receive tax credits for it. But when state agencies went to implement it, they had problems with the way the law was written and had questions, and these senators are coming back to clarify their intention. So 1095 is getting its hearing today. I imagine it does advance, but one to have on the radar. LB 1232 prevents pharmacy benefit managers from reimbursing pharmacies or pharmacists for drugs at a rate lower than the cost of dispensing that drug. And then finally, LB 1333, which is just had its public hearing last week, increases the amount of a matching grant from the state for companies that have been awarded a federal small business innovation research grant. And that was one that Nebraska testified on just last week. And then those other bills of note that I mentioned, LB 1082, this one requires coverage for in vitro fertilization for state employees under the state insurance program. IVF's been in the news the last couple of days, but that's a bill here related to that. LB 1106 and the following one, 1107, both have public hearings tomorrow for those wanting to chime in on those. 1106 provides for lactation consultants to be covered for women on Medicaid. And then the following one is similar, trying to provide coverage for pregnant women in the Medicaid program to receive breast pumps, which I was actually surprised that is not currently covered because it is for a lot of insurance companies nowadays. LB 1124 increases funding for evidence-based early intervention home visiting programs. These are programs where a professional can come meet even with a mother before she's given birth, but then once a child has been born, sometimes it's a nurse, sometimes it's a social worker helping families, usually they're families who are underserved families, maybe in poverty. So this increases funding for that. LB 1223 creates a state funding source for a statewide diaper distribution program for low-income families. The law says that the state would then contract with a local nonprofit. There is a diaper bank. That's why I have it listed as the diaper bank bill. It's a nonprofit that currently does this and is hoping to secure some state funds to help with their operations. LB 1278 provides for Medicaid reimbursement for a doula, for providing doulas or full spectrum doula services to individuals on Medicaid. There have been some great results with doulas in impacting or improving health outcomes for women and children who are African American. There are a lot of disparities right now in birth outcomes, and doulas and some programming in the Omaha area has been very effective. They're hoping to get additional support for that through this Medicaid program. And then LB 1284 from Senator Walz. This is her priority bill, and it deals, this one's not in the health space, it's in the STEM or the tech education space. Last year, the legislature passed a computer science and technology graduation requirement for all high school students in Nebraska. What they have realized in the last year is that in more rural areas, some of those school districts don't have all of the infrastructure, the training, the teachers, the curriculum to be able to follow through with that graduation requirement. So Senator Walz is looking to create a fund of money that districts can use for training, for curriculum development, those pieces. So, the intention of the bill last year was to make our young people even more tech savvy to try to grow the tech workforce. And she's looking to support those. I think it's largely the rural districts be able to have the capacity to actually live up to the standards that were passed. I will go ahead and take a moment and see if anyone has any questions. You can unmute yourself if you do. All right. Well, I'm going to keep going and talk then, kind of shift gears and talk about how to engage in the process. I'm going to start by talking about how Nebraska Cures came forward with our bill this year, because maybe you have an idea. Maybe there's something that you're seeing where you're working that you think, man, there's got to be a better way to do this, or the state is getting in the way of our ability to do my job. So Nebraska Cures had been meeting with stakeholders in the medical research space and the public health space for a couple of years. And a reoccurring theme we were hearing is we're scientific researchers at the University of Nebraska at Creighton, but we can't get access to cancer data in the registry. So our state has a cancer registry where information about cancer patients is held for the purpose of improving health outcomes by studying that data and having different pilot programs, testing different treatments and seeing what those outcomes are, early prevention screenings, things like that. Requests right now, some of them are taking more than a year to get approved, or some are just languishing with no response. So the impact that's having is it's hurting our ability to raise money to do research, because most research is NIH, the National Institutes of Health. You have to write a grant and have the data and prove you'll have the data to prove your outcomes later. And so it's impacting researchers' ability to get research and to research the causes and monitor the effectiveness of prevention treatments. So after visiting with them and studying what other states do, I did take some time to look at how cancer registries in other states were set up, we went ahead and approached Senator Brad von Gillern with a bill that requires the Department of Health and Human Services to respond to data requests within 8 weeks. He agreed to be a co-sponsor, found 35 other co-sponsors, and we held a public hearing on February 1st. So we took this idea, we heard there's this problem with the Department of Health and Human Services and getting data. We studied the issue and looked at what was happening in other states, came up with a plausible solution, and then brought it to the senator. He himself has unfortunately a strong history of cancer in his family, and he was very interested in working on this legislation. So we had our public hearing. What you do is you line up a couple of expert testifiers to come in and share why this is a problem. So we had researchers from UNMC and from Creighton come in with the senator to make the case for this. It was a great public hearing. Right now, not every bill necessarily has to cross the finish line with this one. The senator has actually arranged a meeting between the cancer researchers and the Department of Health and Human Services to sit down at the same table and see if they can work out their differences without passing the bill. But we do have that bill still there and active in case those discussions don't go in the way the senator would like to see them go. And we could still pursue that legislation as the year goes on. One way or the other, we're just happy if researchers can get better access to data. And they used to have this access. That's maybe the most frustrating part, is that 5 years ago, 10 years ago, if they asked for the data, they got it. And right now, there are barriers. So maybe you don't have a bill that you yourself are interested in creating and presenting, but you have seen something I've shared today, or that you've read about in the paper that you want to engage on, but don't really know where to start. So I'm going to talk a little bit about the state's relatively new online testimony system. I'm going to now actually share, if I can find the thing, share a different screen of mine so I can walk through the actual legislature's website with you for a moment. So this, for those of you who might not be familiar with it, is nebraskalegislature.gov. They are trying to make tweaks to make it a little bit more user-friendly, but it is what it is. I'm going to try to walk you through how to find a bill and where to submit comments if you're interested in doing that. You can always email your senator directly or other senators. That's a way to do it too. But one way to really make sure that your voice is heard is to register it formally through the website. I'm going to go to one of the bills, 1106, that has a hearing tomorrow. So say you felt moved by this particular piece of legislation to provide for lactation consultant coverage under Medicaid. So you go to the bill number, you find the box, you type in the bill number, and there is a button here for submit comments online. You can see below the notice for the hearing. The public hearing is February 22nd, but you click on the button and you get kind of an understanding. I'm going to click out of this for now, just what it is. And then you have the ability to submit your comments. It tells you by 8 a.m. tomorrow, if you want this to appear on the record, you need to get this in by 8 a.m. to appear in that hearing record. Even if a committee hearing is passed, you can still submit your comment. It just won't be a part of the public hearings record. So it's pretty self-explanatory from here. Putting your name and information in there, selecting your legislative district. It has the Find Your District button if you need that help. Maybe you're representing yourself or an organization. You can choose other if you're representing some organization of people. Choosing proponent, opponent, neutral. And then I typically write my comments in a Word document first or a Google Doc and then cut and paste them in here. You are limited to just 500 words, but you know what? You could write 2 sentences of support if that's what you felt like you wanted to do, just to register your vote. Because the first thing when you look at the public comments, that when the senators see who has commented online, they're just initially seeing the name and if they're part of an organization. So even if you just want your name listed, you can go in there, say, I support this or oppose this, and then your view is on the list without also having to draft a dissertation or something, or feeling like you have to write the perfect thing. So that is that process. I'm going to go back to the main page real quick. They have just recently this year added this simplified view button so you can see that chart I talked about. so you can follow a bill and where exactly it is in the process, if maybe you're not as used to having to read the notes in this chart here. Are the comments read out loud during the hearing? Jenny, they are not. The senators just have it in a record. They have access to pulling it up themselves. They are not individually read out loud. And in some cases, on that DEI bill facing the university system, there were over 500 comments just on one side. So no, they're not read out loud that way. If you want to be heard face to face, you have to go to the hearing to be on the record in that particular way.
Hey, Amanda, as a former state senator, can you tell us how you weighed comments, letters, things like that came in?
Yeah,
The consideration you were giving to them versus people that testified, all of,
for sure.
Yeah.
For sure. First, I love your background.
It's engineering week. Did you know that? So yeah.
Hey, wonderful. So yeah, I mean, being there, there's nothing that can replace being there in person and testifying in person. The flip side of that is if you have a hearing that goes on for 8 hours and people are all kind of sharing the same thoughts because they want to be there in person, that is also not necessarily productive. If it's a bill that maybe, I would especially say if you can get there in person and you're passionate about it and it maybe isn't like the bill that's getting all the attention, like being there in person can really make a difference, on a bill that's maybe more nuanced or people really don't understand the topic as well. I'll tell you on that DEI related bill, like I had reached out to stakeholders and they're like, just submit a comment. We've got so many people coming anyway. It almost becomes counterproductive, or let's just get through the students who want to testify, and put a face to those issues, especially like if you have like being there in person, if you have a true experience, with whatever they're trying to correct and change to. Yeah. Yeah. Thank you for the question. But like if all you can do is submit a comment otherwise, please do. It is better than nothing. It's better than not engaging at all. And it's sometimes strategically helpful to do it as comments, because senators do look at that full list of, okay, what side has the most responses? Not that that necessarily means they're going to go with whatever side has the most, feedback. You don't necessarily want that either. But it is impactful to see, a lot of comments in there. For public hearings, if that is something of interest to you or engaging in. And at this point in the session, unfortunately, most public hearings are done. There are those couple still tomorrow and next week. But you watch for public hearing dates online, on the bills. A hearing flows in a way where a senator introduces the bill with a 3 to 5 minute opening. All the people in favor of the bill testify, and then everyone who's opposed to the bill testifies, and then neutral testimony comes up. Testimony is typically limited to 3 to 5 minutes, with additional time for questions from the senators. And this is especially true in committees that have a lot of bills, or they know they're going to be there all night because there's a super controversial bill coming up. That's when they limit that time frame. And it is up to the chairs about how much they want to limit it. If they want to say one side is getting an hour and the other side is getting an hour, and then we'll be done. I've served on committees where people have had both philosophies, and to each their own. I guess there are pros and cons. Like anything, like any bill, there are pros and cons to just about every idea. So preparing comments, whether they're online or in person, keeping it simple is very important. For online, I mean, you have a word maximum, or even in person, a time limit. But trying to think of what maybe unique you could bring, what unique perspective you could bring to an issue. And just knowing senators are reading a lot of information and hearing from a lot of people, and that's where the simplicity is just really important. If I would get an email that was essentially a 3-page Word document, it was hard. It was hard to digest that. Just being honest. Use key data, stories, experiences, and values when you are, drafting those comments. Beware of jargon. Even like there's some things you might not realize are jargon, but they are in the medical world. Like just not assuming everyone knows what every disease is, even or technology is. So doing what you can to also explain in a way that maybe you would to your neighbor or to a teenager. Avoid exaggerative or loaded language. I mean, this is just a preference of mine. I mean, there are issues that get us all fired up. But I try to think about how would I want to be communicated with if someone was trying to convince me of something, what kind of language would maybe get through to me? Or if I am trying to, get my opponent on board, what language is helpful in that? And advocating for STEM in particular, I have found like building relationships with lawmakers is really important, even outside of having a bill that you're approaching them with. So taking meetings to explain what your research is on, or the certain new innovative tech career that you're in that they may have never thought of. Just coming to them with information that they might find useful about how the economy and the workforce, so that you have a relationship with them before maybe a more difficult issue arises that you might want that relationship with them on, so they have a basic understanding of where you may be coming from, or what the tech sector is like right now, or what research is like right now. Exchanging information on issues, even when you don't have a specific ask. So that's kind of in tandem with that first one. Personal stories when you have them, whether it's your career story. We just had a great a legislative luncheon last week where we had 3 panelists talk about their experiences trying to increase the number of women in STEM. We had a wonderful high school senior and some folks from the College of Engineering and Don't Panic Labs talking about different career pathways and being supportive of women in STEM. And so we were trying to get those personal stories and employers and UNL there to share those things directly with them in a way where we didn't have a specific ask of them. We were just educating them. When possible, identifying shared values. You know, everyone, I believe that people who run for office are all there for, to make Nebraska better. They just may have a different way of valuing things than you may. So I'm speaking in terms of if you're in a disagreement or have an opposing view with someone. But you can usually find some values. You can even like Google what are the typical values supported by people who are more progressive or more conservative, and you can see justice, versus liberty and those sorts of things. And then try to craft your argument based on the values that you think will resonate with that person. And then recognize that change rarely comes immediately. There are some people, some lawmakers who are dug in on how they feel on certain issues, and you're not going to change their mind, and you'll just frustrate yourself by, continuing to try to change their minds. But many of them are open, to the slow drip of, okay, I'm learning about this. I'm not with you yet, but you don't give up on them. You share the information, you come back with more information, you still try to use that tone, use those other pieces for what you might be advocating for, identifying those values and how to communicate with them in hopes that over time, they may adjust the way they see a particular issue, or and I've seen that happen as a lawmaker. And I see it starting to happen with a few people who are newer right now, which is encouraging, because no matter what perspective people come from, you want people to be open-minded to additional information. And so often on most issues, there are legitimate issues on 2 or 3 sides of a bill, and it's all about trying to meet in the middle and figure out how to make legislation that works for the most people over a slow period of time, usually. All right. Well, I'll be happy to take additional questions here in a moment, but real briefly, beyond the conference, which you see on there, we do have a webinar that'll be coming up on March 19th with Rachel Wagner from UNL. She's the biomedical engineering student, PhD student, who is a part of the partnership that launched the surgical robot into space and is doing experiments. So that's going to be a really great conversation with her. And then, like Sasha mentioned earlier, we're working on happy hours and other events in Omaha and Lincoln and out in Kearney. For more information or contact information for us, you can find it here on this slide. Otherwise, I'm happy to take questions.
Amanda, what is your view on, everybody gets those form letters, contact your senator.
Yeah.
And I'm always curious, and I mean, this feels like a loaded question because I know the answer to this, but I think it's important for our constituency to understand, how those are received.
Yeah, I do not prefer form letters. And it's where, honestly, I would almost rather just see a name on a list, like of, okay, here are all the people who support or oppose. I don't need the whole, like a form letter, for those who don't understand, is say you're the Nebraska Bankers Association and there's a bill on banking that the association doesn't like. So they have a draft letter that they then, or email in this case nowadays, that they share with all their members, and they say, email your state senators this exact letter. and so then our inboxes get inundated with the exact same letter from 300 people. It's impactful, like, but what it tells us is that organization is really organized. And that can be helpful, that can be powerful, but it can also just be like, oh, that's the bankers. It is like, it's when you can provide something unique to it that catches the eye then, and maybe gets a little bit more attention. It's not that it's not that a form letter invalidates people. Maybe I shouldn't shrug it off quite like that, but and in some cases there are advocacy organizations. I know the pet advocacy groups were also very good at that when I was there, and where we get the same letter about pet safety or pet abuse sorts of things. And you kind of get to know the constituents in your own district that care about certain issues too. And so it's like, you don't need to send the form letter. You can say, hey, it's me again, and even be like more casual, and like you have a relationship with them, just letting just doing my due diligence and letting you know how I feel on this particular issue, as you can imagine. And I'm a banker, and this is how it impacts my business. That is much more impactful than the form letter anyway. Any other comments or thoughts? All right. Well, thank you for taking the time to be with us today. I do have, really quickly before I log off, if I can find it here in a moment. I've got too many windows open with everything I've been sharing. We do have a post survey. I can also email it out to folks. But let me get this. Okay, here it is. I just got to drop it in the chat here, folks. That we do appreciate people filling out to help us know if this was beneficial to you, if you would like additional advocacy information, if a training or something more thorough is of interest to people that gets more into the nitty-gritty of how to participate in the legislative process, just can give us some ideas on how we can continue to move forward and educate everyone on how to engage in policy making. All right. Thanks, everyone. Have a beautiful day. It's another lovely one.
Thanks all.